So part of the work that I've been doing with UKONS is that we established in 2021 with the UK Acute Oncology Society and stakeholders and other charities like Macmillan Cancer Support, National Education Group. And we had a basis for what education needed to be delivered to staff who are engaged in acute oncology and encounter patients who are at risk of oncological emergencies. And that was the UKONS Acute Oncology Knowledge and Skills Guidance. We also had available a suite of online learning resources for staff at different levels of practice within acute oncology. But we didn't have any standardised resource for being able to assess competence. So as a group, we decided that what would be great is to have something that had a very similar format to the UKONS SACT Competence Assessment Passport and develop a suite of passports for staff working within health services across the UK, but for acute oncology. We applied for some funding from NHS England, what was called Health Education at the time. Health Education England at the time is now called NHS England Workforce Training and Education Directorate. And that gave us funding to be able to appoint Gina, who's the project manager for the project. So the CASCADE project has worked with stakeholders across the UK at all levels of practice who have different roles in terms of educating, training and delivering acute oncology services. And we have co-designed a suite of competence assessment passports across 4 levels of practice for professionals from lots of different professional groups. So doctors, nurses, radiographers, paramedics, and so on, and also in different settings, so primary care, acute trusts, cancer centres. So at the conference this year, what we're going to be presenting is the outcome of the phase 1 of the project, which was the development of these documents, and we will also be introducing the work we're doing currently, which is phase 2, and Gina will be able to tell you more about phase 1 and phase 2 of the project.